We had lymphatic capillaries, we have lymphatic vessels, we have lymph nodes, and there are three specialized lymphoid organs. The thymus, easily mistaken for the thyroid when it's late at night and I'm trying to give this lecture. The thymus actually lies above the heart, inferior to the neck and the thyroid gland. Your tonsils are lymphoid organs, and they contain follicles and germinal centers with lymphocytes in them. Some people consider tonsils simply to be MALT, mucosa associated lymphoid tissue, and they don't consider it a proper lymphoid organ. However, tonsils have follicles and germinal centers and a capsule. The spleen, located only on the left side of your abdomen, kind of tucked beneath the stomach and pancreas, your spleen is known as the red and white blood cell graveyard. The spleen has white pulp containing an abundance of leukocytes. There's red pulp, also containing an abundance of erythrocytes. And these are both places where these cells are being broken down into their component parts for recycling. I have lymph nodes here with a question mark because technically lymph nodes fit the definition of a lymphoid organ, being an encapsulated organ of follicles and germinal centers. But some people don't consider lymph nodes to be full organs. They consider them to just be lymphatic tissue. Um, yeah, actually, there are many people who don't consider anything to be a lymphoid organ except the spleen. And on that subject, there are some people that consider red blood cells or I'm sorry, there are some people who consider red bone marrow to be a lymphoid organ. And then there are some people who do not consider red bone marrow to be a lymphoid organ. I do consider red bone marrow to be a lymphoid organ. Personal opinion. Yellow bone marrow is composed of adipose connective tissue, whereas red bone marrow is composed of reticular connective tissue, which is also contained in lymph nodes. That's why I think it's a lymphoid organ. Caught among the reticular network of fibers are usually tons of B cells, just kind of like doing their job, dividing into plasma cells, making antibodies. Woohoo! There's also macrophages that are roaming around. However, there are no T cells, none. The blood capillaries, and here's a capillary here. Oh, this is a big capillary here. These blood capillaries are sinusoidal capillaries. And that's because they have to be the most permeable capillaries to allow the largest of the white blood cells that are being made in the bone marrow to diffuse into these sinusoidal capillaries. Oh, here's one right here. And then be swept away into circulation. In this picture, you can see some other capillaries, and they have like stellate cells around them, which are the macrophages. And then there's even an adipocyte right here, because red bone marrow does have fat in it, and triglycerides with their oil droplet and nucleus pushed to the side, but no T cells. I think sometimes students get confused with the thyroid and thymus. And I think that that is only because that they are both in the same general area of your neck and they both begin with TH. The thymus is the home for developing T cells. B cells develop in the bone marrow, T cells develop in the thymus. Lymphocytes that have been designated to be either a CD4 helper T cell or a CD8 cytotoxic T cell, they are sent to the thymus kind of like to mature or to be schooled. As you age, your thymus gets smaller. And as you age, you also enter into something called immunosenescence, which is a state that reflects your decreased ability to create lymphocytes as you age. The thymus is separated into lobules by dense connective tissue called septa. And you can see that septa as white lines running through the histological picture of the thymus on the left. As with many organs, each lobule has a cortex or an outer covering, and a medulla or an inner juicy center. T cells begin maturing in the outer cortex, and as they move toward the juicy medulla, they differentiate their cell surface receptors and they obtain identities as a CD4 helper cell or a CD8 cytotoxic cell. The spleen is considered the largest lymphoid organ. It's tucked away on the it's tucked away on the left side of your abdominal cavity, kind of in between the pancreas and your stomach. Just like the thymus, the spleen has lobules that are separated by dense connective tissue. However, in the picture on the right of the spleen, that dense connective tissue is taking up a pink stain, whereas the previous picture of the thymus, it wasn't taking on much of a stain at all. Each lobule of the spleen has an inner medulla and an outer cortex. The inner medulla is usually made up of white pulp, which is like a standing army of lymphocytes and monocytes that are ready to begin battle if necessary. The red pulp of the spleen is more toward the inside of each lobule and is what is referred to as an erythrocyte graveyard. This is where erythrocytes go to be broken down, phagocyzed by macrophages, and then broken down into their useful recycled parts. Tonsils are considered lymphoid organs as well. However, it depends on who you ask if they really consider the tonsils to be a lymphoid organ or a lymphoid tissue. There can be some disagreement. One main characteristic that tonsils lack, which a spleen and a thymus have, is an outer capsule separating it from the mucosal tissue around it. The capsule around tonsils is incomplete. You have three sets of tonsils. The lingual set is under your tongue, the palatine is kind of at the roof of your mouth, and the pharyngeal tonsils are at the back of your throat and are sometimes called the adenoids. Although that's kind of an old name these days. Many people who work in healthcare, retail, teaching, whatever profession where you're exposed to a lot of other people and their poor immune systems throughout the day, sometimes that can cause repeated infections of the adenoids. And now, if you're a teacher who needs to speak, repeated infections of the adenoids it's a career killer. And so this is why some people do choose to have their adenoids removed if they keep becoming infected.